What does it mean? Dr. Cheryl here. Achoo! What could that possibly mean? If it's cold and flu season, you think you're coming down with something, right? Well, let's take a look at some signs and symptoms of not only the cold or flu, but allergies and other things that might be happening when you get these symptoms. I have distinguished them here on this chart. We're going to distinguish between a cold, the flu, allergies, and something which is called the stomach flu, but it's not really the flu. That's where a virus, which is different from the respiratory viruses of the cold and flu, that's where a virus infects the gastrointestinal system, and you have symptoms there. For duration, a cold could last 4 to 10 days. The first 2 to 3 days, you're really contagious. A flu can last 2 weeks to up to a month. It can be that long. You can be contagious before you have the signs and symptoms of a flu, but also 2 to 3 days in, you're pretty contagious. It could go as long as 7 days, or even for kids, they're contagious for about 2 weeks. An allergy is a response to something in the environment. So therefore, you're not contagious. You're just responding to pollen, dust, whatever's in the environment. Now, what's called the stomach flu, again, is not really the flu, but it's something you've ingested, whether it's a bacteria or a virus, and it's causing you discomfort and symptoms. That can last for 1 to 3 days. Now, the stomach flu can happen anytime, just when you happen to eat that bad food. Allergies tend to be seasonal, but the seasons can be not just spring and fall. Some places like in Arizona, there are December, January pollens that are causing havoc in people who are sensitive allergically. The flu happens most often in the winter, and so do colds. However, there is something called a summer cold. So whenever you tend to be run down and need a break and your body needs to clear out, that's when you'll get a cold. Now, a cough can be a symptom in some of these syndromes. A cough in a cold can be mild to moderate, but in the flu, it can be severe because with the infected respiratory tract, your body's trying to get it out. It's rare in an allergy, and it doesn't happen in what's known as the stomach flu. A headache is not common in a cold, but it will be severe in the flu, mostly because you're having a fever. In allergies, you can have a mild headache if your sinuses are congested, and it is possible in what's known as the stomach flu because of what's going on with your system. Aches and pains are typically mild in a cold, but severe in a flu. It can feel like your bones are breaking. It can be that bad. It's often not in allergies, but it could be possible in what's known as the stomach flu, a gastrointestinal. Fever is rare in a cold, but that's one of the initial signs that you're coming down with a flu. Having a low fever can still mean you're having a flu. You're just not very effective in fighting it. A fever does not happen in allergies and not in gastrointestinal problem. Watery, itchy eyes is what's common in allergies, along with sneezing. It's rare in the flu, rare in a cold. It depends on where the virus has landed. The sore throat is common in a cold. In fact, that's often how you know you're starting to get a cold. Also in the flu, it can be common to have a sore throat as beginning signs of the flu, or further on too. Occasionally you get a sore throat in allergies. You can have all that drainage down your throat and make it sore, but would not happen in a gastrointestinal problem. Stuffy nose is common with a cold. That's that stuffy nose. I got a cold, right? And you can have sneezing in a cold depending on how your body is responding. Occasionally you can have a stuffy nose in a flu. It's common in allergies. It might be the sinuses, but it could be the nose too that's stuffed up. But it does not happen in a gastrointestinal illness. Vomiting does not happen in a cold, and it's very rare in the flu. It doesn't happen in allergies, but that is one of the cardinal signs that you have an infection in your gastrointestinal tract. Take a good look at this chart and see what the signs are for each of these syndromes. We don't necessarily need a label of a cold or a flu to start treating at the first signs. Check out my e-course, Preventing and Warding Off a Cold or Flu. It's available on my free app. You can download it at your Apple Store, your Google Play, and then you can register and order this e-course that I'm making, which is going to explain the signs and symptoms of these things and what to do at the first sign so that you can prevent or ward off a cold or a flu. Check out the links below, and I'll see you later.